Understanding meningitis. Symptoms, causes, treatment and prevention. Meningitis is a serious medical condition that affects the brain and spinal cord. It is caused by infection, inflammation, or a combination of both. Understanding the symptoms, causes, treatments and prevention measures for meningitis is essential for the early diagnosis and management of this potentially life-threatening condition. Symptoms may include headache, fever, stiff neck, sensitivity to light, confusion, nausea and vomiting. Bacterial meningitis is often caused by the same bacteria that cause ear infections, and can be treated with antibiotics. Viral meningitis is more common and is usually less serious, but can still cause long-term health problems. Vaccines can prevent some types of bacterial meningitis. It is important to be aware of the symptoms and causes of meningitis, as well as the available treatment options and preventive measures, so that it can be treated quickly and effectively. What is meningitis? Meningitis is an inflammation of the meninges, the layers of tissue surrounding the brain and spinal cord. Meningitis is a form of meningitis which is caused by the inflammation of membranes. Meningitis is a very serious infection of the meninges, which is the layers of tissue that cover the brain and spinal cord. There are three types of meningitis: bacterial, viral, and fungal. The bacteria that cause meningitis can be either Streptococcus or Neisseria. The viruses that cause meningitis are either herpes simplex virus, varicella zoster virus, or cytomegalovirus. Most cases of meningitis are caused by bacterial meningitis, which is usually caused by Streptococcus bacteria. The most common cause of bacterial meningitis is infection with Streptococcus bacteria, which is usually contracted during a viral upper respiratory tract infection. An example of a bacterial meningitis symptom is headache, fever, sensitivity to light, nausea and vomiting. Symptoms of meningitis. Meningitis is a serious condition that causes inflammation of the membranes around the brain and spinal cord. The causes of meningitis are bacterial, viral, or fungal meningitis, which can cause a variety of symptoms. Headache is the most common meningitis symptom, often accompanied by fever, sensitivity to light and nausea and vomiting. Other symptoms may include confusion, decreased attention, and irritability. People with bacterial meningitis may also experience stiff neck and sensitivity to sound, touch, and movement, as well as vomiting. A particular type of meningitis, called leptomeningitis, causes symptoms such as severe head pain, vomiting, extreme sensitivity to light and sounds, and reduced reflexes. Other symptoms of bacterial meningitis include a stiff neck, and sensitivity to sound, touch and movement. Causes of meningitis. Bacterial meningitis is caused by the bacteria that cause ear infections, and can be treated with antibiotics. Viral meningitis is more common and is usually less serious, but can still cause long-term health problems. It can be caused by herpes simplex virus and varicella zoster virus, but vaccines can prevent some types of viral meningitis. Fungal meningitis is caused by fungi that are also called yeast or fungus and can also be treated with antifungal medications. Treatment of meningitis. While there is no cure for meningitis, mild to moderate forms of meningitis can be treated with antifungal medications, antibacterial medications, and antiviral medications. In some cases, blood transfusions and surgery may be needed. People who experience a severe form of meningitis may need to be hospitalized to be treated with intravenous fluids and intensive care. Prevention of meningitis. Preventing meningitis is difficult, since the condition is caused by a variety of bacteria, viruses, and fungi. However, by following meningitis prevention tips, people can lower their chances of contracting the condition. Meningitis prevention tips include keeping your immune system strong by getting enough sleep, maintaining a healthy diet, and exercising regularly. Additionally, avoid getting caught up in stressful situations such as engaging in high-risk behaviors, because this can weaken your immune system. Bacterial meningitis. Bacterial meningitis is one of the most serious forms of meningitis. It is caused by certain strains of bacteria that usually enter the body through the nose and throat. The bacteria then spread to the meninges, causing inflammation. The most common bacteria that cause bacterial meningitis is the Streptococcus bacteria. Symptoms of bacterial meningitis include headache, fever, sensitivity to light, confusion, nausea and vomiting. A stiff neck, seizures, and difficulty swallowing are also common signs of bacterial meningitis. Viral meningitis. Viral meningitis is caused by a variety of viruses, including herpes simplex virus, varicella zoster virus, and cytomegalovirus. Generally, viral meningitis is milder than bacterial meningitis, and symptoms are less severe than bacterial meningitis. Viral meningitis can be spread through respiratory droplets, which are tiny droplets that are released when the infected person is coughing, sneezing, or inhaling respiratory bacteria. Most viral meningitis is spread by the herpes simplex virus, which is usually mild and causes blisters on the skin. Symptoms of viral meningitis include high fever, headache, nausea, vomiting, sensitivity to light, confusion, and seizures. There may also be reduced reflexes and a stiff neck. Vaccines for meningitis. Vaccines are a great way to prevent meningitis because they stimulate the immune system to fight off infections. There are a variety of vaccines that are available, including vaccines against 4 types of bacteria that cause meningitis: Haemophilus influenzae, Neisseria meningitidis, Streptococcus pneumoniae, and Pneumococcus. Varicella vaccines are also available, which can help prevent varicella zoster virus meningitis. The best meningitis vaccines are those that contain vaccines against more than one bacteria, including Meningococcus, Pneumococcus, and Meningitidis. The best practice is to have the vaccine within 2 weeks of being exposed to meningitis bacteria. Long-term health effects of meningitis. Meningococcal meningitis can lead to long-term health effects such as hearing loss, memory loss, and strokes in some cases. Long-term health effects of meningococcal meningitis can be severe and may include long-term health problems and a weakened immune system. Meningococcal disease can also be fatal, and people who get meningococcal disease are also at risk for other serious infections such as sepsis, pneumonia, and bacterial meningitis. Vaccination against meningococcus protects people from bacterial meningitis, and is the best way to prevent meningococcal disease. Conclusion. Meningitis is a very serious infection of the meninges, the layers of tissue that cover the brain and spinal cord. It is caused by bacteria, viruses, and fungi, which can be spread through respiratory droplets, and is usually milder than bacterial meningitis. Vaccines can prevent some types of bacterial meningitis and viral meningitis, and there are antibiotics and antifungal medications that can treat bacterial meningitis. Syphilis. Causes,